The sight of more than 1,000 islands scattered across an azure blue ocean gives Maldives its idyllic image. Having achieved 5 out of 8 Millennium Development Goals and with the remaining 3 being on track, Maldives, a middle-income country since 2011, has been a shining example in WHO's Southeast Asia region for its development milestones and the achievements in public health over the past few decades. Sustained control of communicable and vaccine-preventable diseases, decline in maternal and infant mortality have been possible due to a commitment towards the goal Health for All with community health workers pioneering the public health initiatives in the island communities. However, sustaining these historical achievements is not easy with the small island nation facing the impact of globalization head-on, given its limited land for agriculture, a near-total dependence on import of goods and services, and a narrow economic base dependent on its tourism and fishery.
We face huge challenges in delivering healthcare. Some of the challenges which we have are common actually to the rest of the countries in the region or elsewhere. One example is raising cost of healthcare delivery. Everywhere in the world, countries are struggling with finding ways and mechanisms to bring down the cost and make it health service delivery more efficient, more cost effective. So it's a challenge we also share.
As elsewhere in the world, Maldives is facing a changing disease epidemiology with non-communicable diseases (NCDs) causing 70% of all deaths, lifestyle risk factors such as tobacco use, imbalanced nutrition, obesity, and lack of exercise.
What we had about 30, 35 or 40 years back was totally different. By then, the problem was all related to communicable diseases. But now the challenge is lifestyle related diseases.
A rapid expansion of medical services with a focus on curative care over the past years resulted in rising public health expenditure due to increase in health systems inputs such as infrastructure, workforce, pharmaceuticals and supplies dependent largely on purchase from abroad.
Some of the other challenges which we have perhaps may be unique to the Maldives or we face it more. One example is health professionals. We rely heavily on expatriates. About 80% of doctors who are working in the Maldives are foreigners, 60% of nurses are foreigners. There are some paramedical professions where 100% of the staff working here in the Maldives are expatriates. Also, we rely on import. All the items which we need to provide health services are imported, and the weak procurement and supply system here in the Maldives, especially the system within the public sector, it raises the cost of these products several folds.
The very nature of the island nation, with a small population living on 200 inhabited islands stretched over 2 hemispheres across the waters of the Indian Ocean, is a given challenge.
So there's got a lot of dispersed people all over the country, and with a small population of nearly 320,000. So per unit cost of healthcare in Maldives is much higher than any other large land-based countries.
To control costs and enhance universal access to services, the Maldives government engaged in reforming health sector by reviewing of its health financing strategies for human resources and centralizing procurement services. Universal health coverage has received an increased attention after the World Health Report 2010 and has never been higher on the agenda of international health as well as within the countries. Universal health coverage actions are motivated by the objectives of financial protection, improving equity and quality of services.
There should be a mechanism that there is enough health protection systems, public health measures, prevention and health promotion activities, so that we don't fall ill easily. And when we fall ill, we should be able to get back into health without expenses that we can't afford.
How UHC concept is understood by policymakers, those who have the duty to deliver healthcare and those who have the right to claim those services, and in particular how the concept is operationalized on the ground are important prerequisites for success of public health in Maldives today. In 2008, the National Health Insurance Scheme Madana was introduced, which covered about 25% of the country's population. 4 years later, in January 2012, the introduction of Asanda, the country's universal health insurance scheme, signified the largest change. Run through the public-private partnership, Asanda offers a comprehensive scope of benefits for services, drugs and diagnostics within a given annual cap.
We opened it up for all. The government provides initial health cover for every citizen. Health Insurance Act was enacted, taxation was introduced, and at the same time also in the health sector we also started doing the program budgeting, and also the national health accounting system was initiated, so that we know how the money we get is spent. We believe that the government alone take care of the healthcare services, so we encourage the public-private partnership.
Evidently, the patients appreciate the benefits of the Asanda scheme.
Asanda amade marabodu pase.
यार आसंदा के बेस में यार में हमें जो हम पहुँचे में लोगों में पाली के बेस में बस तथी उन्दकुले कानुले लोगों में नम इकड़ों हमें जही केंदे मिहातने बस कहले दच्चम उन्दकुले ने आसंदा के बेस के कंतके
हम माहू का दांजे माले स्कैनिंग हंदाला एतिगस तेवं आसंदो मिकड़ो एडमिट को फर्स्ट नुजे आने के अंतकों आसंदों हम जी के मोएवेदो.
However, while Asanda intends to provide safety net, both government and household out-of-pocket expenditures are on sharp increase, thus leaving economically disadvantaged population at risk.
I think it's important that we try to keep up and maintain the model of health services where patients don't need to pay from their own pockets. It's very important. I think that element is missing at present, because we have a cap, we have a limit of 100,000 for 1 year, and that 100,000 is often exhausted in people who really need it most.
आसंदा के दशुंग आइले इनका अने लामा हमें फिर तमा लॉन्च होदंग वारंग उंदगवे हिराशुगा अने हॉस्पिटल लॉन्च हाला पे फोते दे हमें अमिला को तुम लॉन्च होदागे अने नोली बिगिंग कोस्ट गार्ड होदंग कोस्ट गार्ड होंगा.
As the country gains more experience in universal health insurance, it is expected that Asanda can be more efficient and sustainable.
It is functioning to the extent that government puts in resources, it is functioning. It is not functioning with any degree of autonomy or with any degree of efficiency. So that is one area that needs to be reviewed and overhauled, and Asanda should be made a scheme that really meets the demands of the people, and a program that could be sustained. I believe we will be able to do it.
Substantial savings for the scheme could be achieved by reducing costs of medicines.
Essential drugs has to be supplied through the one, because health service without pharmaceutical is not complete. So currently today pharmaceuticals in the private sector, and that's why the pharmaceuticals is not doing the supply of pharmaceutical is not adequate, because only profit making drugs have been supplied.
In order to bring the costs of medical supplies down, the government of Maldives has undertaken steps towards strengthening procurement and supply capacity, establishing a centralized procurement and introducing generic medicines.
Moving to generic medicine is, I think, essential and crucial if you want to bring down the cost and ensure the quality of services, quality of pharmaceuticals.
Maintaining costly health workforce and infrastructure in each island does not necessarily result in utilization of health services in those islands. At the same time, medical facilities in the capital Malé are observing sharp increase in patient turnaround. The tertiary level Indira Gandhi Memorial Hospital experiences an elevated pressure.
People are very health conscious in a way, so when they get even a simple viral fever, they come to hospital seeking medical assistance for that. In the whole country there is no referral system. The patient has got his own right to choose a specialist, and they have self-referrals. Many times when a specialist sits in the OPD, some of the patients they see, at times even up to 50% of the patients, they see may not require that specialty referral at all.
The other reason is the universal health insurance in Maldives is a free service, whereby the people do not have to pay anything to get the health insurance. So I think there is also another reason for the pressure from the relatives to be referred to a higher center, though there is no specific reason which is required for the referral.
Irrespective of availability of services, I think there are a large number of patients still preferring to travel to Mali, or even the locals in Mali, a lot of them are traveling abroad for delivery. So it's partly a preferential choice, not necessarily because there is a medical need for the travel.
The expectation of our population, our people also has, they now see when they want to actually get medical treatment, they either go to India, Sri Lanka, Singapore, Bangkok. In our country, our people expect public system to provide that type of private health care, and meeting this challenge, the demand is quite a challenge actually.
Uneven utilization of services poses bigger policy questions on organization of the health system, sustainable human workforce strategy, review of payment mechanism to stimulate a more responsible and accountable provider and patient behaviors.
I think we need to go back. We need to go back, giving an equal emphasis and equal importance to preventive medicine, to public health and to health promotion. And then public health itself is a huge area with very wide scope, and where the responsibilities lie often beyond the health sector. But I think health sector's role should be advocating and ensuring that those changes and are brought, those reforms are brought, and we have the necessary mechanisms and means for people to live healthy and live a better life.
World Health Organization began its successful cooperation in Maldives in 1951 before the country's independence in 1965. The WHO country cooperation strategy includes universal health coverage as a blueprint with a focus on health system strengthening and its redesign. This combines with WHO's traditional assistance to disease prevention and control and highlights the WHO's coordinating role.
WHO remains a trusted partner in Maldives' current efforts towards universal health coverage. The most important question to answer today is what works, and WHO is working together with the government to find answers to those questions by gathering and analyzing data and finding and providing policy options for the Maldives to choose its own path. Maldives has turned a new page in its history. Maldives faces new challenges, tremendous challenges, those challenges which cannot be overcome alone. With new needs and changing environment, WHO is also transforming as an organization. These transformations allow to offer new avenues of health diplomacy and diplomacy for the Maldives to interconnect with other actors regionally and globally in order to enhance and mutually enhance its health and development.